Well, unavoidably, you could avoid it, but why would you? Because people who embrace AI are going to be more capable, more effective, more efficient, and more successful in their practice. So it's like saying you're not going to use a computer when hearing aids went digital. Well, you could, but why would you? First of all, it'll allow your patient to do a little bit of self-assessment before they come to see you if you set your practice up that way. So you can use AI tools to do a little bit of needs assessment, which offloads some of that time when you're in the clinic. Once you're in the clinic, AI, if you have the tool provided to you, AI can help you in determining the treatment strategy for that unique individual. Everyone's different. Two people with the same audiogram will respond differently. But using AI, it can look at a vast database of over 1 million patients and start to identify unique segments and unique treatment strategies for each individual that falls in front of you based on data. So imagine you could say, well, according to our AI database, you have a 90% chance of being success if we can give you this hearing aid in conjunction with a remote microphone based on 10,000 people who have had the same result as you. How confident would that patient be in the solution that you're giving them and in being confident to use that technology with that? Well, if you could, that patient's life would be best if you could follow them around their whole lives. Watch them, monitor them when they're at home, when they're at work, when they're socializing. Obviously, you can't do that, nor would you if you could. But AI can, with the sensors on a hearing aid or on a smartphone or on like a Fitbit, can monitor the environment, monitor how they're doing, provide advice to the person right there based on what they're experiencing, or inform you that the patient is having a challenge and that maybe you can ring them up and say, it looks like maybe we can help you succeed more in these situations. We've used the Apple Watch in order to look at biometrics that can determine the amount of fatigue that someone with a hearing aid is experiencing. So imagine you could say, well, it looks like in your time that evening, you were more fatigued than normal. Let's see if we can help you with that. Yeah, so we've been using AI in a variety of ways. One way is using large language models like ChatGPT to simulate different types of patients in order to help train audiologists better in case history taking, in discussing the results of the audiometry, in terms of recommending treatment strategies. So if you're new, you may not know how to overcome objections, or you may not know how to discuss in the right way the outcomes of the test. You only get that through practice. Well, it'd be better to practice on an AI patient rather than maybe practicing along with real patients where you might make mistakes when you don't want to. So that's one tool that we're developing for training audiologists and for assisting new audiologists in developing their communication skills. We're also leveraging big data. We have access to a database of over 1 million patients where we can look at, again, for example, reverse slope hearing loss is a very difficult type of hearing loss to treat. We can look in the database and see how audiologists have treated those patients, over the past 20 years across thousands of patients, apply AI in order to extract meaningful solutions for future patients who fit that same audiometric configuration. And we're going to be incorporating that in our new NL3 prescription, which again is based on revising the NL2 prescription based on machine learning assessment of this large database. AI can also be used to predict what might happen in the future with your patient. So a certain configuration of a certain hearing loss and a certain lifestyle may mean that they're going to have greater needs from you down the road than a different kind of patient with a different hearing loss configuration, a different lifestyle. If you knew in advance, based on this AI prediction, what the future for them holds, you can prepare them better and prepare yourself better. So, for example, if you knew that they were more at risk of a deteriorating hearing loss, you could say, you know what, I really need to see you in every year because there's a 70% chance that your hearing loss is going to get worse and we need to adjust your hearing aids for you. As opposed to another patient who you may go, you've got an 80% chance that nothing's going to change. Just call me if you notice something. And that, as a healthcare provider, that makes you a lot more efficient and effective with your time and with your patient's time. Sure. AI can do simple tasks. I mean, think about audiometry, doing a hearing test. Do you need a highly skilled professional audiologist to measure a pure tone threshold? Probably not. I think an AI system can probably do that pretty well. So where is your value? Your value is understanding the complex needs of your patient, giving them the trust, the motivation, the confidence that the solution that you're recommending, both technology solutions, lifestyle changes, behavioral changes, are going to help them. You could go onto Google and you could say, I have a hearing loss, what should I do? And Google could spit out something, but is a patient going to trust that? No, they're not. When it comes to health, humans want to talk to other human medical professionals to make sure that they're doing the right thing, they're getting the right treatment, they have the confidence that the approach that they're taking is the best. And that's not going to change, I think, in my lifetime. And so the counseling, the motivation, that human care in providing the understanding of what they're going through and giving them the solutions is critical for the human component. Integrating, let's say when mobile phones first came out, I think people might have been reluctant to integrate those into their lives and rely on them too much. People who grew up with that from the get-go, they probably couldn't live without it, and they've got no problem adopting new technology. So I think younger generations, this will be the norm of what they expect. And so if they are exposed at an early age to digital solutions, whether it's a real doctor on the other end of that computer monitor or an artificial one, and by the way, you can't tell the difference anymore, whether that's a real human or not a real human, doesn't matter if you trust in what you're being told. And again, the reason that you're there, what is the ailment that you have? What does it mean for your life? What are your treatment options? What are the recommendations? And how do you move forward with those? Those are what you're looking for, but it's about trust. I think today, even if there are diagnoses where AI is much better than a typical human because the level of accuracy is very high. But I think most people, including myself, even though I know that, I still want a trusted healthcare professional to look at the results and translate them to me and give me the confidence that, yes, what this is coming out makes sense, because we know that AI can hallucinate or simply make mistakes. And so I would want a trained professional, even if I trust that statistically AI is going to come to the right answer and the right diagnosis. I want the professional to give it their seal of approval and also be able to answer my questions effectively, again, in a way that I can trust and believe. Yeah, so AI has created new Seinfeld episodes in the tone of the original shows. So, but that's because it's a great mimic. So AI can learn from patterns and then can mimic those patterns very well. I don't know. But when I mentioned in my talk that used to be chess was considered the last bastion of human, intellect against computers. And Kasparov, when he lost to Deep Blue in '97, he was convinced that it wasn't a computer he was playing against. He thought there was a human feeding it information because Deep Blue was making creative moves that he didn't think were machine-like. And he really thought they were human-like glimpses of creativity. So can AI create... Look, at the end of the day, our brain is a neural network. And how do you become an artist? Typically because you observe artistry and you see patterns, then you try to create original patterns. There's no reason that a digital neural network couldn't do the same thing. Well, will it have self-awareness? It's unclear to be able to ask the why, but as a consumer of the art, do you care? Well, look, maybe it challenges us to leverage what we believe makes us human, which is creativity and innovation and doing challenges and being bold and everything that we don't typically would apply to a robot, which we kind of think of as being subservient. Well, and get away from the digital world and get into the real world. An AI isn't going to go fly fishing, but you can, and you can appreciate and enjoy that experience.
So is that what's left is?
Well, there's nothing wrong with saying, well, now humans really can, enjoy a sunrise and the fresh air and the mountain peaks and the cold and all that. But it does raise interesting things about professional practice where AI can now pass the law exams and can provide legal advice as well as a human lawyer. What does that say about being a lawyer these days? I don't know. I mean, there's still the trust component today, but in the future, I think people will learn to trust the AI lawyer, probably more so than a human, perhaps. Let's say there was someone discovered a lost Miles Davis album. And everyone got excited and you heard that album and it's something you've never heard before, but it's clearly Miles Davis. Then what if someone said, well, actually, that was just an AI generated it? Does that change your enjoyment and your appreciation of the music? Because the music fundamentally hasn't changed. How it got created does. So is the act of creation important? So how the information and who's creating that information that they're delivering to you, is that important to you?
Surely done. It's done. It's finished.
Yeah.
It's maths. It's physics and it's
Yeah.
maths.
Yeah.
It's just sound and permutations.
Yeah, but I'm a big David Bowie fan, and again, if there was a lost album, and it sounded just like Bowie, but I knew it wasn't him, I don't think I'd love it. I don't think it would grab my passion if I knew it wasn't really him that had created it, because then it's not him speaking to me. So maybe I'm interested in the person and how he's communicating to me through music. You could spend the rest of your lives hearing AI-generated Beatles songs. Would that be satisfying? I think we'll find out.